recent years, there has been an increase in the amount of emergency department admissions and deaths related to heroin and opioids in the United States. As you can see, there has been a shift from many people using opioids to heroin, and this has resulted in a large increase of heroin deaths. So based on this, there has been internet search data that has been provided by Google as a way to help monitor and predict the different health outcomes. This data has been able to help the industry approach disease prevention and monitoring from a new light. So this data trend can be used to help predict emergency department admissions that are associated with heroin use for the following years to come, and hopes to help reduce the amounts of deaths. But it can also be used as a way to identify and estimate the change in heroin trends or opioid trend outcomes early on. They can do it based on geographic regions. But however, even with the internet search data to give insights for predicting these outcomes, there's still a lack of certain data necessary to predict heroin and opioid behaviors to be able to accurately use it as a main way to address the opioid crisis.
The study conducted 9 metropolitan areas in the United States were chosen to track their internet search history to see if there's a trend between their search history and an increase in opioid use. Certain phrases and keywords were utilized in order to use that into the research, and this is when they came up with a total of 10 keywords and phrases to use in that research model. As a result, there was an increase in heroin-related admissions as high as 1,194 per 1,000 in a population. This included cities such as Minneapolis and San Francisco. Minneapolis happened to have the highest increase of them all, of about 23%, and San Francisco had a decrease of about 21%. The things that were taken into consideration was the 12 keywords, poverty-related inequality, and the total number of emergency department visits. So the study does mention that it doesn't take into account that not everybody uses Google as their search provider. I think that other things that should be taken into account is the access to healthcare, as not everybody has the opportunity to visit an emergency department in the event that they have some crisis with opioid use. Another thing that I think can skew the data is not being aware of the increase or the decrease in the opioid production, and I think that being able to track down the root of the problem, which is the production or even smuggling, can help end the opioid crisis, and I think that the low-cost method that they use in this research can still be implemented to find that.
Technology has revolutionized so that everyday people can track their health in many ways beyond just stepping on a scale or using a pedometer. Technologies like the Apple smartwatch has become a medical device to detect irregular health rhythms. It allows people to monitor their heart health as easily as checking one's temperature. For many, self-tracking has become incorporated into their lifestyle. Personal tracking could potentially save a lot of time and money for patients and doctors, and could deliver more accurate results while eliminating unnecessary medical visits. However, self-tracking does raise a few concerns. For one, there are ethical and privacy concerns that question who also has access to patients' data. There is also a lack of regulation given that more and more apps do not meet the data safety standards or guarantee the accuracy of the measurements, while some do not have evidence that it even works. In my opinion, it is also problematic that most of these technologies are costly and are geared more towards people who are able to afford what some would consider a luxury. The next step would be finding a way to create devices that are affordable for those who need it the most, such as the lower class who cannot afford medical costs. These won't be a solution, but they do provide a cheaper alternative.
Predictive analytics technology is controversial due to its promotion rather than its ability to make important clinical decisions in critical moments. Although algorithms of image detection for diabetic retinopathy are well validated and have been demonstrated being successful, Physicians have the responsibility for applying the data by the predictive analytics and using it as a decision making process to identify what is best for the patient. As predictive analytics obtain more data, an important question arises. Will the predictive analytics provide additional data for discussion, or will it be used as a definite clinical answer provided for the patient?